We have seen how the dynamic assessment routine is used to assess the first three building blocks of Morocco: movement, rotation and centration. The final two building blocks, comfort and visual acuity, are required to finalise the fit of the lens. First, comfort. During the assessment of the lens, the patient should be asked about the lens comfort. If a patient has never worn lenses before, they may take the normal settling time to become comfortable. If a patient has experienced discomfort with previous lens types, it is important to emphasise that these soft lenses should be very comfortable. If a lens is fitting significantly flat and is mobile, the patient will report discomfort which will not settle with time. A tightly fitting lens may initially feel very comfortable, but after a while, the patient may report general discomfort in one specific area. Now use the information about lens movement, rotation, centration and comfort with the KeraSoft IC Fit Assessment Guide. On the chart, there are three different fitting zones. The optimal fitting zone contains the fitting characteristics of an optimal lens fit. The tight fitting zone contains the characteristics of a tight lens fit, while the flat fitting zone displays fitting characteristics of a flat lens. Use the clinical tips on the chart to reassess your first choice lens. If the fitting characteristics of the lens match with those in the optimal zone, perform an over-refraction while the lens is settling. With this initial over-refraction in place, assess the visual acuity. Assess whether the vision remains stable or is better or worse after the blink. The visual acuity found with an optimal fitting lens will remain stable during blinking. A tightly fitting lens will result in the visual acuity improving after the blink, then deteriorating again as the patient stares. If visual acuity becomes worse after the blink and then clears on staring, the lens may still be settling, or this may indicate that the fit is flat. If this does not settle with time, then this confirms the fit is flat. Even if the fit appears optimal in the slit lamp, the quality and stability of the vision should be used as the final indicator as to whether the lens is fitting optimally. The ideal situation is that the lens fits optimally. If this is not the case, use the guidance on the KeraSoft IC Fit Assessment Guide to change the fit of the lens by choosing the next most appropriate base curve to try. Once you are satisfied with visual acuity, allow the lens to settle for around 15 minutes and then refine the over-refraction, noting the back vertex distance of all lenses. Then perform a final assessment of the 5 fitting characteristics using Morocco VA as the guide to ensure the lens is fitting optimally. In approximately 20% of cases, an optimal fit may not be possible with standard periphery lenses. For example, a lens that appears to fit well may give a poor visual result, or vice versa. In these cases, no one standard periphery lens provides the correct combination of fit and visual acuity that satisfy the Morocco VA guidelines. In these cases, the periphery of the lens can be changed to achieve the optimal fitting scenario of good fit and visual acuity. The next module will provide guidance on how to change the periphery of the lens so that an optimum fit is achieved.